What if I tell you that another pandemic is coming to us? Yes, a new strain of virus is spreading globally at a slower rate, but this is 10 times more dangerous than COVID-19 virus. COVID-19 only affects 10 species, but this deadly virus has the potential to affect 138 different species. It has already started to affect poultry and wild birds in different countries. You will be shocked to hear that history's most deadly pandemic, Spanish flu, which happened a century ago, was the cause of one of the strains of this virus. It starts at a slower rate, but then spreads after the incubation period gradually, and the name of this deadly virus is Influenza A virus. Its new strain, H5N1, is the new bird flu virus that can cause a new pandemic.
Here's an expanded overview of the H5N1 virus with detailed information and data. H5N1 virus, an overview. The H5N1 virus is a subtype of the Influenza A virus, known as bird flu because it commonly affects wild birds and poultry. It is highly pathogenic, meaning it can cause severe disease and high mortality rates in birds. Occasionally, it can infect humans and other animals, leading to serious health concerns. Current global situation as of May 2024. Wild birds. The H5N1 virus is widespread in wild birds worldwide, posing a continuous risk for transmission to domestic poultry and other animals. Poultry. Sporadic outbreaks have been reported in poultry flocks, affecting the poultry industry and prompting culling measures to prevent further spread. Dairy cattle. An ongoing multi-state outbreak has been reported in U.S. dairy cattle, marking a concerning development as it indicates the virus's ability to infect mammals. Human cases. There have been 2 reported human cases in the United States since 2022, with 1 case following exposure to dairy cows and another following exposure to poultry. Detailed statistics and facts. Human cases. The United States has reported a total of 2 human cases since 2022, with the most recent case reported on April 1, 2024, following exposure to dairy cows. The previous case was reported on April 28, 2022, following exposure to poultry. States affected. The exact number of states affected by poultry outbreaks and dairy cattle outbreaks remains undefined as of early May 2024. Surveillance data. Cumulative data on wild birds have been collected since January 20, 2022, and on poultry since February 8, 2022. Human cases have been monitored since April 28, 2022, and dairy cattle data since March 25, 2024. Public health risk assessment. The CDC considers the current public health risk from the H5N1 virus to be low. However, due to the virus's potential for rapid evolution and its widespread presence in wild birds and poultry, vigilance is necessary. The CDC is actively monitoring the situation and working with states to monitor individuals with animal exposures. Protective measures. Wild birds. People are advised to avoid direct contact with wild birds and to report any sick or dead birds to authorities. Food safety. Properly handled and cooked poultry is safe to consume. There are specific recommendations for products from other animals with H5N1 virus infections, including cattle and milk. Occupational safety. For those working with potentially infected animals, protective measures include avoiding unprotected direct physical contact with infected live or dead animals or surfaces contaminated by them. Preparedness and response. Surveillance. The CDC is using its flu surveillance systems to monitor H5N1 activity in people and animals. Preparedness. The CDC, along with state and local public health partners, is preparing for the possibility that contemporary H5N1 viruses gain the ability for increased transmissibility among humans. Travel advisory. No travel restrictions are currently recommended related to bird flu to countries affected by the virus in birds, other animals, or people. The symptoms of H5N1 in humans can vary from mild flu-like symptoms to severe respiratory illness and complications. Here's a detailed list of symptoms associated with H5N1 infection in humans. Flu-like symptoms. Fever over 100.4 degrees Fahrenheit, 38 degrees Celsius. Cough. Sore throat. Runny nose. Muscle ache. Malaise, general feeling of discomfort. Eye infections. Conjunctivitis, red swollen eyes. Gastrointestinal symptoms. Diarrhea. Vomiting. Respiratory difficulties. Shortness of breath.
This is the moment when infection begins.
Difficulty breathing. In severe cases, the infection can lead to life-threatening complications such as sepsis, pneumonia,
They seem like random blobs.
organ
In
failure,
reality, they are tiny keys, proteins that have evolved.
acute respiratory distress syndrome, ARDS.
enabling them.
It's important to note that these symptoms usually start within 1 to 5 days after exposure to the virus, and occasionally it may take longer. If someone exhibits these symptoms and has been in contact with infected birds or traveled to areas with an outbreak, they should seek medical attention immediately. For diagnosis, healthcare providers may use blood tests and swab tests of the mucus. They may also perform auscultation to examine abnormal breath sounds, X-rays to assess the condition of the lungs, nasopharyngeal cultures to check for the presence of pathogens, and complete blood counts, CBC, to detect levels of white blood cells, WBC. Additionally, reverse transcriptase polymerase chain reaction, RT-PCR, can identify the virus by detecting its genetic material. Treatment for H5N1 in humans typically includes antiviral medications such as oseltamivir, zanamivir, and peramivir. It's crucial for patients to follow their healthcare provider's recommendations and practice good hygiene, like regular hand washing, to prevent the spread of the virus. To minimize the risk of H5N1 infection, individuals can take several preventive measures. Here's a detailed list of actions that can help protect against the virus. Avoiding exposure. Wild birds. Avoid direct contact with wild birds and observe them only from a distance. Sick or dead animals. Do not touch surfaces that may be contaminated with saliva, mucus, feces, or materials contaminated by wild or domestic birds or other animals with confirmed or suspected bird flu virus infection. Personal protective equipment, PPE. Gloves. Wear gloves when handling animals or cleaning surfaces that might be contaminated. Respiratory protection. Use an N95 respirator if available or a well-fitting face mask, such as a surgical mask, especially if you are in close contact with potentially infected animals. Hygiene practices. Hand washing. Wash your hands with soap and water after touching birds or other animals or surfaces potentially contaminated with the virus. Avoid contaminated water. Do not swim in water bodies that may be contaminated with bird droppings. Food safety. Cooking poultry. Ensure poultry is properly handled and cooked to an internal temperature of 165 degrees Fahrenheit, 74 degrees Celsius to kill potentially harmful viruses. Dairy products. Follow specific recommendations for products from other animals with H5N1 virus infections, including cattle and milk. Monitoring health. Seek medical attention. If you've had direct contact with potentially infected animals and become sick, seek medical attention promptly. Vaccination. Get vaccinated against seasonal flu to reduce the potential for co-infection with seasonal flu and bird flu. Workplace safety. Farm workers. Livestock farms are being provided with funds to bolster protective measures and testing for the avian flu virus spreading among dairy cows. Infection control measures. Follow updated recommendations for infection prevention and control measures, including the use of PPE and testing. Reporting and surveillance. Report sick or dead birds. Report any sick or dead birds to local authorities to help monitor and control the spread of the virus. Stay informed. Keep up to date with the latest advisories from health authorities and government agencies. By following these measures, individuals can contribute to the efforts to control the spread of the H5N1 virus and protect themselves and their communities.
Now he's sprinkled his donut box